Welcome to the webinar Psychological Care During Emergencies Tools to address the psychological impact on people in my community. My name is Cristina de San Roman, a communicator specializing in disaster risk management, and I will be accompanying you throughout this activity. I would like to inform you that we have enabled a button for you to leave your comments and inquiries. Additionally, I would like to inform you that all questions received through this chat will be answered via email, along with the sending of supplementary material. Let's get started. Very well. According to the World Health Organization, individuals who endure an emergency situation experience some form of psychological distress, the severity of which decreases over time. In most cases, however, the psychological and social effects of emergencies can also deteriorate the mental health and psychosocial well-being of these affected populations in the long term. Therefore, in the face of an emergency situation, addressing the psychological manifestations of the people in the impacted community is vital. To achieve this priority objective, it is necessary to undertake coordinated actions among those providing humanitarian assistance, which includes both governmental entities and non-governmental organizations. The purpose of this USAN webinar is to provide various support groups in emergency care with useful tools to manage the psychological impact on community members. To this end, I am pleased to introduce our guest of the day, Licenciada Claudia Gomez Prieto. Claudia is a specialist in clinical psychology. He holds an international diploma in human rights, sustainable development, and disaster prevention policies. She has taught courses at various universities in the region. She has participated in and coordinated several assistance programs for victims of crises and emergencies, as well as programs addressing the emotional impact for response personnel. She is a member of the Regional Mental Health and Psychosocial Support Response Team in Emergencies of the Pan American Health Organization and the Advisory Group on Disasters and Sustainable Development of the Regional Office of Science for Latin America and the Caribbean of UNESCO. Welcome, Claudia.
Thank you very much, Christina. Thank you for the presentation and welcome to everyone. Thank you for the invitation to be part of this webinar focused on strengthening local and community capacities in the face of disasters. And for that, we will talk today about the psychological perspective in disasters. And we will begin with the first part, which is to understand what we mean by a psychological perspective in disasters. To do this, we will take some concepts such as disaster, vulnerability, and psychological impact. And although these are topics that we know may be well known to you, we want to take a new look, perhaps, from the perspective of psychology. What do we then understand by disasters? From the perspective of how it is interpreted by human beings, from a psychological standpoint, they are certainly adverse events of great magnitude that cause significant damage, loss of life, property, and productive resources, and they often exceed the usual organizational capacity of individuals and communities, thus requiring the mobilization of extraordinary resources. In psychology, we often refer to these situations as disruptive situations because they burst in from the external world and create a perception in the person of a threat to their integrity, which is why they are considered disruptive. Of course, we cannot talk about disasters without considering the concept of vulnerability, understood as the condition that predisposes individuals to suffer harm and losses in the face of these adverse events. We also know that disasters do not affect randomly and always have a much more negative impact on the most vulnerable. Among these major vulnerabilities, we know that the poorest communities usually have limitations in accessing social and health services in everyday situations, which means that in an emergency or disaster situation, this situation is exacerbated. They often lack plans and resources to prevent and face emergencies because they precisely lack frequent care networks. So, what do we understand by psychological vulnerability? Psychological vulnerability, which is part of overall vulnerability, relates specifically to the perception of a threat to a person's integrity, which deepens the perception of human vulnerability. And why is this the case? Well, precisely because they evoke the presence of death, because they disrupt the usual course of people's lives, and because they generate an initial feeling of vulnerability and lack of resources to respond. We could say, in summary, that psychological vulnerability is related to a feeling of helplessness and lack of protection. Why do we then talk about the concept of vulnerability? The concept of psychological vulnerability? Well, precisely because we want to approach what in the disaster situation, what in the emergency situation causes some type of psychological impact in order to then understand what we can do about it. Within that vulnerability we were discussing, we must take into account that there are some at-risk groups that need to be considered especially. And why is this the case? Because in addition to the inherent and general vulnerability of all individuals and communities, there are specific situations that add to this, such as groups related to gender and diversity issues, indigenous peoples, people with disabilities, children, the elderly, those with chronic illnesses, individuals living alone or in some form of isolation, migrants, racial or religious minorities, and also the acting personnel. And what would these at-risk groups have in common? What would they share in that extra factor of risk in relation to psychological vulnerability? Well, in most of them, issues of gender, indigenous peoples, children, the elderly, and the sick. In reality, what many of them lack is autonomy. Autonomy to make decisions. Autonomy to be able to exit an emergency situation with some type of resources, material resources, and even family and social resources. So, at that point, these at-risk groups have something in common. And why do we consider the acting personnel as part of the at-risk groups? Because they are in contact with pain, they are in contact with the vulnerability of those they have to assist. And this also puts them at risk. In relation to the impact, on the other hand, we need to define who we consider to be affected. Let us not forget that our role is to understand the psychological perspective, to understand psychological vulnerability, to understand the impact, so that we can then think about what to do and what not to do. Therefore, we need to consider to whom our interventions are directed. In this regard, we consider those affected to be individuals who have suffered some type of loss, including both real and symbolic losses. We understand real losses as the loss of human lives, the loss of loved ones, material losses of all kinds, the loss of property, and symbolic losses such as those related to the loss of a job position, the lack of trust or security that may arise from a community's lack of resources, or the unavailability of educational services, for example. On the other hand, people with injuries or, of course, personal losses, family members and friends of the victims are affected. And among the response personnel, police officers, firefighters, civil defense, doctors, nurses, stretcher bearers, all those who participate directly in some type of response to the affected individuals must also be taken into account when we consider any type of intervention. And of course, we must not forget to take into account the witnesses and the communicators. Those who witness or are present during a situation of pain, such as a significant loss in a community, as well as those who recount it, can also be susceptible to experiencing some form of psychological impact. Well, having defined what we understand by disaster from a psychological perspective as a disruptive situation, and psychological vulnerability as that which puts me in contact with the threat to integrity, and having understood why some groups are particularly considered at-risk groups, let us then consider the psychological impact. The psychological impact occurs precisely due to the feeling of vulnerability and helplessness caused by the close presence of death, the sudden onset of the unexpected, the losses suffered, and the disruption of the usual course of life. Of course, there will be different magnitudes, and the type of repercussions generated by that psychological impact will be highly variable. The magnitude will depend on the severity of the event, the type of losses suffered, the family and social support networks available to individuals, the personality of the subject, and the psychological coping resources. I want to clarify here, because we talk about the community and we are thinking about the community, but we are also considering that this psychological impact is individual. It is about how it affects each person, personally, right? And it is already clear that the assistance received can cushion that psychological impact, which is why it is so important that we take it into account from the very beginning. On the other hand, among the various characteristics that an event can have and its situation, in relation to the impact, it is important to consider that the origin and the characteristics of that event can influence the type of impact. For example, if it is a natural phenomenon, or if it involves phenomena in which humans have intervened, that is, if there are human actions involved, whether these actions were negligent or intentional, whether they were unique events or repeated occurrences, and whether they could have been anticipated, meaning if the 2000 community had any kind of warning or early alert regarding the event that allowed them some level of preparation, the type of losses suffered, and the number of affected individuals. These are just some characteristics that an event can have regarding its origin and features, which can influence the psychological impact. Now, having defined this path, let us say, to understand the psychological perspective, let us then move on to the manifestations that this impact can express. How can they be expressed in reactions? How can they be expressed in manifestations? As you will see, up to this point, and before moving on to the manifestations, we are not talking about symptoms. We are not discussing a pathology at this moment. We then say that manifestations of psychological impact may be related to problems with concentration, fears, irritability, intolerance reactions, sleep disorders, eating problems, feelings of apathy, lack of interest, various anxious reactions, and hypervigilance reactions, meaning that the person is constantly feeling that something bad may happen. Feelings of insecurity, sadness, a sense of the event recurring in images and memories. Feeling of helplessness, difficulty in resolving everyday situations and making decisions. These are some of the most common manifestations that can occur together, some of them with more intensity than others. Of course, not all of them have to occur in the same person, but they are the most frequent in individuals who have gone through an emergency situation due to a disaster. Now, it has often been said that these manifestations constitute some type of disorder. However, we should initially consider the normal, usual transient reactions of adaptation to the impact. They should not be regarded as pathological. All people are susceptible to being impacted. And in reality, the fact that we have some type of manifestation shows us that our psychic apparatus is trying to adapt to this disruptive situation. Of course, there are some people who recover more easily. Cristina de San Roman mentioned this very well in her introduction, which relates to the guidelines from the Pan American Health Organization and the World Health Organization. We must consider that the impacted individuals are not necessarily going through any type of illness or pathology, but it is true that some recover more easily, while others need more prolonged specialized support. Well, within the psychological impact, we must also consider that the personnel who respond to emergencies and assist the affected individuals, those who arrive first, such as security forces, often even teaching staff, doctors, nurses, volunteers, and many times the community itself are helping each other, right? They assist one another as neighbors. What happens to the acting personnel? Well, they often experience fatigue as they are exposed to painful images in a very intense and prolonged manner. on the other hand, empathy towards suffering, can sometimes lead them to excessive involvement, which can result in not only being affected by this situation, but also having greater difficulty in recovering. Well, in the acting personnel, some additional issues can also be added. Can a person have a defensive reaction, such as a dehumanizing attitude towards the victims, treating them as if they were objects, but which is actually a reaction to pain, isn't it? On the other hand, a difficulty in distancing oneself from the task, a reluctance to disengage from work at the end of the day, a rejection of relationships and activities unrelated to work, and often, very frequently, feelings of guilt. And why feelings of guilt? Because, of course, facing very painful situations often makes us feel that what we do for others is very little, that what we do for others is not enough. So that usually generates feelings of guilt, right? I think that for now, we would conclude the first part and give the floor to Christina so she can tell us what comes next.
Excellent. Thank you very much, Claudia. The presentation of this first topic about these disasters is very, very important and very interesting, right? Regarding this psychological perspective, concepts that are crucial for understanding the manifestations that you have clearly presented, which people experience during an emergency, and of course, the acting personnel who are also affected. I would like to take this moment to introduce an interview we conducted with the professional Isabel Hernandez, who is a specialist in clinical psychology and a professor at the Dominican University OIM in the Dominican Republic. It is interesting to listen to her because she shares her experiences in the field on this topic, particularly when it comes to responding to emergencies, and it allows us to exemplify exactly what she is presenting in this first topic. Claudia, let's listen to her. Good morning, Isabel. Thank you very much for sharing your practical experience. Based on your own professional activity in the field of psychology, I would like to start with the following question. Could you tell us about your experience when you have had to provide support to communities in the face of a disaster? What are the main challenges you encounter in providing assistance to people after a disaster, such as hurricanes or tropical storms?
Yes, thank you. Good morning. When we talk about a disaster or an emergency area, we are clearly facing a situation that is abnormal or atypical for the community or family affected by such events. When analyzing or developing the family, community, or territorial response plan, one must consider many challenges that can be encountered in the territory, such as the diversification of the response areas of attention, and the emotional or psychological components of families affected by these adverse situations. Among the main challenges, we take into account population diversity, meaning that we consider the characteristics by age group. It is not the same to respond to or assist a family that has the capacity for recovery and resilience as it is to assist families with a higher level of vulnerability, which may be linked to factors such as extreme poverty, migrant families, families with disabilities, or families led by elderly adults. Additionally, the assistance for families where the household is composed of a single parent with children under 5 years old or infants is different, as their needs are distinct. Now, the main interest at the time of the initial response is to ensure that the family achieves the stability and emotional balance that can be affected by the impact of a damaging event, in addition to or combined with pre-existing deficiencies, the impact of the event, and finally, the socio-emotional impact that the disaster itself can generate. When we talk about this emotional impact, we not only link it to material loss, to the tangible, but also to the damage or alteration of the emotional psychological state of the family in general, due to the abrupt change that often forces them to be displaced from what they considered their safe place. The emotional impact is also closely related to the loss or grief of what the family has built through sacrifice, effort, and daily work, which can be lost in the blink of an eye, within a minute, due to a flood, a fire, or other disasters.
Thank you very much for your response. We completely agree with your point of view regarding other experiences we have seen in the region within the framework of this project. Now, considering your operational experience in the field, when you have had to assist people in the very moment of distress, when people have lost a significant part of their resources and often have also lost human lives, what would be one suggestion you could give to the support staff from other countries regarding direct intervention? What would you suggest?
My recommendation would be to always start with an assessment of damages and a needs analysis at the very beginning. But this damage assessment should take into account the dignifying elements of the affected family and population, and it should consider the most vulnerable groups over the vulnerable ones. As I mentioned a moment ago, all of this can be determined by demographic variables, and it can also be characterized by taking into account gender variables, access to resources, goods, and services. An important element in the context of emergencies or humanitarian contexts is that often the response focuses on urban areas, central locations, or metropolises, leaving aside those territories that are generally farther away from where service providers or rights guarantors are located. A super important recommendation is to always first focus the initial response or first attention on children, as they tend to be the most vulnerable and the most invisible. Generally, if we address or prioritize the family in a holistic manner, we prioritize pregnant women. However, while it is true that responding to these vulnerable groups is a priority, we overlook the immediate impact it may have on children. A testimony that I remember from a recent event is from a community affected by the floods. In November 2022, that year, there were torrential rains, and a video emerged from a community where a 5-year-old girl tells her grandmother, "Mom, we are going to flood again. Let's go now because I am scared." It is very likely that in that community response, the primary needs of the family were addressed, which generally focus on shelter, a bed, and a blanket for hygiene. However, who responded to or addressed the emotional impact that the 5-year-old child experienced? This is just a sample of a larger universe. When we talk about humanitarian contexts and fragile contexts, we start from the needs that should guide or strengthen the sense of the here and now for the affected population, responding to or restoring their dignity. The third super important element is to ensure the reunion or strengthening of the protective mechanisms of affected families and communities, such as immediate access to education services, the guarantee of health services, and here an important element regarding health services, considering that an event caused by a hydrometeorological event, a geological event, or another directly affects the health system, potentially triggering other risk events such as epidemiological outbreaks, gastrointestinal diseases due to the alteration of water quality, among others.
Very interesting your experience. Finally, I would like to ask you about the importance, in your opinion, of training emergency personnel in mental health issues so they can directly help the population and also manage their own mental health, which is a significant challenge at the country level.
Talking about mental health involves a long-term preparation, action with an immediate effect once a trigger or threat materializes. All personnel involved in the different phases of a humanitarian response must be trained and enabled. Psychological first aid is not the same. Governments, states, civil society institutions and civil protection institutions must consider training in psychological first aid, taking into account two important variables. The first variable is that at the moment of responding in an emergency or disaster situation, there is already a disruption in the family or the person I am going to assist or help, and I must be prepared to respond to a reaction that is likely not the most desired or appropriate at that moment. Second, prepare the personnel working in the humanitarian sector, as they can also be directly or indirectly affected by the disaster event that is occurring. If we are talking about contracted personnel or volunteer staff who are engaged in relief and emergency response actions, it is likely that the families or relatives of these individuals are also being affected by the crisis. An important variable is that there may be a discrepancy or a dilemma for this person, which is closely tied to moral considerations. I might be neglecting my family in a vulnerable context to respond to other families, and this same indecision could even evoke situations of rights violations for the person involved in the response action. Therefore, preparing the staff must take place beforehand so that during the response it is assertive, effective, and focused on protecting the fundamental human rights of people in emergencies.
Thank you very much, Isabel, for this new dimension of recommendations that you are presenting to us today. Very well. After hearing Isabel's testimony, we see the importance of ground assistance starting from an assessment of damages and needs, as this assessment is what would allow us to understand how to address the manifestations of what to do and what not to do at the moment of the emergency. To delve deeper into this topic, I would like to bring Claudia back into this discussion to provide us with a bit more information. Go ahead, Claudia.
With pleasure. Thank you very much, Christina. Well, having discussed what we understand by psychological impact and having listened to Isabel, it is interesting that we can then think about how to address those psychological manifestations. And in that approach, what to do and what not to do, at least from a basic point of view, isn't that right? On one hand, before thinking about what to do and what not to do, we have all heard at some point what the recommendations are, what usually happens, and we could say that there are myths and beliefs regarding what is advisable or what is common in a disaster situation from a psychological perspective. Some of these myths, and later we will see if this is the case, state that only specialized services would be qualified to address the psychological impact. When we talk about specialized services, we refer to specialized mental health services, that is, professionals in psychology and professionals in psychiatry. Basically, on the other hand, post-traumatic stress is the most common condition. Post-traumatic stress is an anxiety disorder, defined by the Manual of Mental Disorders as one of the anxiety disorders. Another myth is that during an emergency, a state of collective panic is common, as if this were one of the prevalent reactions. On the other hand, care during the crisis requires the supply of medications. When we talk about medications, we are referring to psychotropic drugs, particularly in the category of antidepressants and anxiolytic medications. On the other hand, it is noted that violence, aggression, and emotional overflow are the main reactions, while on the other side, people who do not express themselves do so because they do not need help. These myths, these beliefs, tend to be quite entrenched in some groups, in some individuals, and even among some professionals. And from now on, if we take into account that if we believe that this is the reality, well, we would have to adapt our interventions to that type of situation. We will see. In fact, addressing the psychological impact, especially initial assistance and the first measures, the initial actions, should aim at initially restoring the capacity for daily functioning. When we were talking about psychological impact and discussing vulnerability, I don't know if you remember that we said that people feel invalidated. They feel unprotected. Therefore, We should focus on that vulnerability and lack of protection in the initial assistance to help the person regain their capacity to function. To do this, of course, it is necessary to assess needs and resources. That damage and needs assessment we referred to earlier. Of course, identifying and strengthening support networks. And when we talk about support networks, we refer to family networks, social networks, and any network that can be established within the community. Community support and family support are part of that psychological assistance. They are part of that sustenance. We could say, so, as general guidelines for action. In response to those affected, initial guidelines would have to express that we are here to help you, inform about the tasks that are being carried out, and ask if they have any family or friends they would like to contact to accompany them. Listen actively, without interrupting. Respect. On the other hand, if the person does not wish to speak, use nonverbal communication. If the interlocutor does not master the language, do not use idioms. On the other hand, demonstrate security, calmness, and interest. Protect the person from curious onlookers and the media. If there are doubts, do not make physical contact. Be attentive to the behavioral changes of those affected, and if the individual expresses anger, allow them to vent and express a willingness to help. These are just some initial guidelines. As you will see, this is not psychotherapy. It is not psychological treatment. These are first measures, first actions that have a therapeutic effect. Because for a person, receiving information, having support, and having someone who wants to listen to their needs helps them a lot in processing and dealing with the psychological impact we mentioned earlier. On the other hand, we should also discuss what not to do. Basically, do not use phrases such as everything is fine or everything will be fine, calm down, this will pass. Not to commit to timelines, actions, or resources that are not under our control. Do not make promises about matters that we cannot know if they can be fulfilled. On the other hand, do not minimize the losses. Do not compare. Look, what happened to you is not that serious because you have not lost a loved one. You have only lost your house, and the person who lives around the corner from your house has lost loved ones. For each person, for each individual, every loss has its meaning. Do not interrupt the silence of those affected, because many times that silence allows them to process the situation on their own. Do not pressure the victim to provide information or rush them into making decisions. Do not share personal experiences. Do not impose ideas, nor contradict or confront their beliefs and practices, whether religious or of any other kind. Do not give information without verifying it first. And of course, do not inform the media before informing the family. All of this, both when we talk about what things would be important in terms of doing and what things would be important in terms of not doing, points to exactly what we mentioned earlier, which is related to helping the affected individual feel more secure. On the other hand, an important topic related to communication and its connection to mental health concerns the respect for the privacy of the affected individuals and their right to intimacy in grief. There should be an institutional spokesperson responsible for providing information to the media and the public. Communicators must recognize the psychological effects of news transmission and consider that communication can significantly contribute to reducing fear, distress, disorganization, and uncertainty. On the other hand, of course, we must take into account that while we said we are talking about normal reactions to an abnormal situation, and we are stating that some people who are not professionals could provide that initial assistance, we also need to consider that there are some cases where we do need to refer to a specialized mental health professional. And when is that the case? Well, when there are severe disturbances in sleep or behavior, extreme isolation attitudes, thoughts of harm and or suicide, symptoms that persist, meaning they not only do not decrease in intensity, but are persistent and increasing, situations of domestic violence, substance abuse, alcohol or drug misuse, dangerous behaviors, severe depression, and impulsivity. These are some of the situations in which we should refer those individuals to a specialized professional. Very well, Yusan. Now, we talked about myths and beliefs at the beginning, and now we should say, well, this is how it is. What would be the reality? We asked, and I framed it almost as a question, whether only specialized services are qualified to address the psychological impact. In fact, that initial care must be provided by trained personnel. But trained personnel may not necessarily be specialized personnel, not necessarily specialized psychologists or specialized psychiatrists, but rather individuals with training. On the other hand, post-traumatic stress is the most common condition. However, there are many manifestations that do not progress to disorders. Instead, they present as a manifestation of impact and gradually decrease in intensity, allowing the person to recover with the care received. That is to say, just because they do not have a disorder does not mean they do not need some type of assistance. Another myth we mentioned is that emergencies frequently lead to a state of collective panic, which is not the case at all. On the contrary, affected individuals tend to withdraw. Right. That care during a crisis requires the supply of medications is not generally advisable. What those affected truly need is support, companionship, receiving information, assistance with paperwork, an empathetic acknowledgement of their losses and the significance those losses hold for them. That cannot be resolved with medication. Of course, those who are referred to specialized assistance may require some type of medication. While violence, aggression, and emotional overflow are primary reactions, they actually only occur in a minimal percentage. It is true that they happen, but the percentage is low. And the person who does not express themselves does not necessarily need help. On the contrary, many people find themselves in such a state of helplessness that precisely because of that feeling of helplessness and the withdrawal that these individuals experience, they do not ask for help. So, well, having taken into account those realities in light of the myths, we wanted to point out as a recommendation and final summary that the response personnel and volunteers are generally the first to encounter those affected, meaning they are the first contact with the emotional impact on people. This means that it is not specialized personnel who provide the initial assistance, and that is why they need to receive training, because in one way or another, they will be providing assistance in some capacity. That would be all, and thank you all for being here.
Thank you very much, Claudia. Your presentation has been excellent. We greatly appreciate the clarity with which you have been able to explain these tools in a very detailed manner for managing the psychological impact on communities. It is important to mention that all this information we are conveying is significant not only for the response personnel, but also provides many tools that community members can consider when facing emergencies. Thank you so much, Claudia, for an excellent presentation, and I would also like to thank everyone who is joining us today. To conclude, we would like to inform you that this webinar is part of the Educational Capacity Development Platform of UNESCO. More webinars are coming, and we are very interested in having you join us for the upcoming activities. To this end, we will be sending more information via email and also informing everyone who joined us today that their participation certificate will be sent to them through email. Thank you very much.